Open defecation is the emptying of bowels in the open without the use of properly designed structures built for the handling of human waste, such as toilets. Now, open defecation is particularly associated with rural and poverty-stricken regions of the world, especially sub-Saharan Africa and Asia. Now, according to the findings from the 2021 WASH National Routine Mapping Survey report, 47 million people in Nigeria practice open defecation. According to 2018, the Nigerian president in 2018, the Nigerian president declared a state of emergency in the water, sanitation and hygiene sector, demonstrating political will at the highest level of government, and launched a national campaign tagged Clean Nigeria, use the toilet to jumpstart the country's journey towards becoming open defecation free by 2025. Now let's discuss this particular issue, and we have joining us in the studio the Executive Director of Center for Environmental Sustainability and Development Awareness, Mr. Olushola Babalola, joining us in the studio. Good morning, and thank you for joining us.
Good morning, thank you for having me on your show.
Good, thank you for coming. Now, how far are we, or how close are we to achieving the open defecation free society by 2025, just 2 years away? Is it something that we, with what is on ground? Last year, I say 47 million Nigerians are still, defecating, freely. What is the journey, and do you think that we can achieve this target?
Okay, thank you very much for that very important question. So far, so good. We are not there yet, because if you look at the population of people that are still prone to open defecation in Nigeria, 47 million, that's whopping. That's about a quarter, of Nigerian population. That's if we go by 180 or 200 million, that we are talking about. And this is according to the latest, survey conducted by Federal Ministry of Water Resources in collaboration with Nigerian Bureau of Statistics, which kick-started in 2018, and they have been doing this consistently. So when you try to correlate the outcome of the survey in 2018, 2019, 2020, and 2021, you will see that there's just a slight, difference, between what is it called, the reduction in the open defecation in Nigeria. So far, so good. The journey is not yet palatable. So we are working towards that, but I think it's something we can achieve. And that is the more reason why we need to mobilize all the stakeholders to make sure that we work towards achieving that, target. And again, for Mr. President to be bold enough to declare a state of emergency, on WASH, that's a very good step, because prior to now, we've really seen the fact that the political will is not really there. One thing is to have an issue, another thing is to accept that we have this problem, and we need to work towards ensuring that we profile lasting solutions to the problem. So, and that's what Mr. President has done, and that's what is expected of every Nigeria, either household, MDAs, or the private sector, to make sure that we work towards achieving, that target. 2025 is not far away, but it's something that we can still achieve. It's something that we can still work towards reducing it. So if we can't meet 2025 target, we have 2020 target, which is more like a global target, that we can still work towards. But I want to believe that working towards ending open defecation by 2025 is a very good development from Mr. President, and we should be able to make sure that at the end of the day, at least we achieve a considerable milestone, even if we cannot, achieve a total or an open defecation-free Nigeria by 2025.
All right, but what are the social-cultural issues that affect the sustainability of, meeting that open defecation target come 2020?
Okay, there are quite a number of it, and we all know that every society has their peculiarity. There are beliefs that are not too sensible. For example, there are societies that said they don't want to share. You see male and female not sharing the same toilet, which we can see in different parts, of Nigeria, as well as in different parts of the world too. So that is one issue. Then again, poverty is one big issue, that we need to consider when we are talking in terms of open defecation. Poverty in the sense that these are people that cannot even afford a single meal. Talk much of constructing, affordable toilet or a good sanitary facility that will help them to, probably do that. So these are things that we really need to look at and see how we can, probably bring about palliative in terms of how do we help people to make sure that they have necessary toilet in place? How do we help people to make sure that we put the right awareness there, give them the right civic education to ensure that some of these beliefs are not, really helping them in terms of, their well-being, in terms of their health and what have you. So there are quite a number of them. The belief is there, so which we really, really need to eliminate. And we need, to put up a very aggressive sensitization towards that. So because we have to correct that impression, it's only when we correct that impression, and that's why people can begin to use toilet. That's why people will begin to have faith and believe in the fact that no, nothing is going to happen at the end of the day. It's not disrespectful. For example, they will said if you are in-laws, a brother-in-law, a father-in-law, are not expected to use the same toilet as, the wife of their son. These are some of the cultural barriers that is actually driving the issue of open defecation in Nigeria. And this is not peculiar to Nigeria alone. It cut across the world. We've seen, that kind of belief in places like India and Indonesia, Bangladesh, and other African countries, even the neighboring Ghana here.
Now, okay, if you look at, if you go back to the basis or to the foundation, how harmful are these practices?
Yeah, it's very harmful. We just have to say the way it is, and we all know the implication or the effect of open defecation in the society. It breeds some of these airborne diseases that we are talking about, especially children under 5 years are more prone, to the effect of open defecation, and this manifests in form of diarrhea, it manifests in form of cholera, it manifests in form of typhoid fever. So we have seen it. Because when you defecate openly and is not covered up, of course, we know the process that takes place. Decomposition will take place, and definitely when that happens, you see the microbes trying to feed on that. And when flies perch, on this, it takes, the microbe to the food, materials. Then again, if this is washed away by rain into the body of water, there is every possibility that those living downstream might probably fetch the same water for drinking or for cooking. So which at the end of the day, exposes them to various germs, that we are talking about, which manifest in form of these diseases that we are talking about in Nigeria. So it's very, very harmful. It's a practice that we need to condemn in a very strong tone. It's practice that we need to find a way to make sure that people, don't defecate openly in the society because of the attendant effect of it at the end of the day.
Okay, you talked about how bad it is for children under 5. How about, its effect on women and girls, especially in their reproductive,
Yeah,
stage?
that's a very good question. Yeah, they are more vulnerable, just like, the children too, in the sense that why waiting for the tick of the night or moving out early in the morning to do the open defecation, we have seen cases of rape in that. Then again, it doesn't really, support their sanitary health. Sanitary health in the sense that when a toilet is when the toilet is not there and people are just defecating openly, there is every tendency that they got infected, at the end of the day. And we all know the consequence of some of these, infection on women, on girl child, at the end of the day. So it's not something that we should condone. It's something that we really, really, really need to work around it and make sure that, we make Nigeria an open defecation-free society. So that's very correct. I agree perfectly with you that they are more vulnerable even than their men counterparts in terms of the effect of open defecation on women, on girl child, because they are prone to gender-based violence in form of rape. They are prone to poor sanitary health in form of catching infection in the process of doing that. So that's very correct, and we need to work towards making sure that we eradicate that in the society.
Yeah, the wash generally is about ensuring that people live healthy, and then diseases at that level that are especially communicable diseases are contained. So how is this open defecation a problem to achieving successful clean and and society that is free of diseases that are that are detrimental to having a very healthy people?
Yeah, so WASH by definition is, WASH is an acronym,
Exactly.
water, water, sanitation, and hygiene. So this is more or less like combining three, interrelated issues together when it comes to the issue of environment. So, and open defecation is an eyesore anywhere. And you see people living around where, people defecate openly, equally have a psychological effect, in the sense that when they walk through the places they are defecating openly, it has an impact in their emotions, in their psychology. It's not something anybody wants to see, be it early in the day or late, in the night. So because of the fact that the stench that is coming from that is a problem, which causes, now added to issue of airborne diseases, then again, it's an eyesore, just like I said, and once there's a contamination with water body, it becomes a very big problem to the society. So it's not just about open defecation, it's not just about doing it there and go, but again, it's a process, that leads to so many other things, in the society. When you defecate openly and get contaminated with water body, the water source, underground water, it becomes a very big health challenge for everybody. This is not limited to the children now, it's for everybody. So that is one big problem about it. And if a society is not clean, there's little or nothing we can talk about water, sanitation, and hygiene. And it's when you put into a good hygiene practice, that's when we talk about no open defecation. That's when we talk about open defecation free society. So, and until we begin to put up that sensitization to say that, look, it's all about your health. You can't defecate openly and you think you're going to have an healthy society, so, or live an healthy life, just like you said. That is not going to happen, because at the end of the day, because it's going to affect, it's just like a chain. It's going to affect so many things. You defecate, you leave. In the next 30 minutes, fly will come and perch on it. The same fly will go to the marketplaces and perch on the food materials, perch on the water. And at the end of the day, we all know the resultant effect of that. Then again, if it goes down into the soil, it's going to contaminate the ground soil, which of course people are prone to take again. And if that is not properly, taken care of in terms of maybe boiling it, or in terms of maybe try to make sure that it is well preserved for drinking purpose, for cooking purpose, or for domestic purpose generally, it becomes a very big issue in the society. Then again, it constitutes a menace to that society that practice open defecation, because people will want to avoid that, society, because we said it's an eyesore. The stench alone will deter anybody, from coming to that, particular society. So these are resultant effects that the issue of open defecation can actually bring about when it comes to WASH.
Okay, now we know how difficult it is sometimes, to implement some projects in rural areas. So now let's say that, this particular project of, fighting open defecation doesn't work out, or it proves, difficult to fight in these rural areas. Are there alternatives?
Yeah, there are quite alternatives. So just like I said, in any community, the first thing we need to identify is the drivers of open defecation. There are different community has their peculiar, challenges. In some challenges, we are talking about the fact that they lack toilets. They have issue of toilet deficit. In some places, it's just about education. They need to have adequate education. But I will give you an example. In the course of our implementation last year, so we sampled the opinion of the people that, okay, in marketplaces, because we map out some places in Abuja, markets and motor parks. So, and when we interview people, we are asking them, for example, in Jabi Park, which is about the largest park in Abuja. So we are asking people, we saw that they have toilet facility. Yes, it might not be enough, 5 toilet as big as that place is. So, but you ask people, so why are you guys not using toilet? And they ask you that, look, they can easily catch infection, which is right. But again, they are treating this toilet because they clean them up every now and then. They wash them with Isa, which is the most important thing for anything to do. Then there is water. There is availability of water, because when we are talking about toilets too, if the water facilities are not there, it constitutes another problem.
Talking about water supply being an issue.
Yeah.
What about dry toilet facilities? Is that also a good alternative?
Yeah. So dry toilet facility to an extent depends on the community now, just like we said. So because if the water is not there, and we really need to curb the issue of open defecation, then we resort to dry toilet facility, but with a caveat. So the caveat is that they have to follow the principle of dry toileting. You understand? Because it's not just about using it, you have to cover it up when you use it, and you make the surroundings clean so that it's appealing to people. So these are steps that we really need to educate people about it. They need proper orientation about how to use different, classes of toilet. So that is very important. So when we asked them, and they said no, they can never use it because once you use a public toilet, you are prone to infection. Yes, that might happen if they don't take proper care of it, if they don't sanitize it, if they don't clean it up. There is every tendency. But in a situation whereby they clean up, that's a belief that we need to correct. That look, and we have some. It's not about education. We have some educated people that had the same belief too. That once you go, even in the hotels, good hotels, they will tell you I can't use their toilet. That's what people will tell you, I can't use their toilet unless it is my room. You understand? Unless I lodge into the room. If they ask you to use the common toilet, they will tell you they are not using it. So these are part of education that we really need to give to people. So they will want to do it in the comfort, in their comfort zone. And some people are like that naturally. They will tell you this is the best time to take their cigarette, and they need their freedom to do it. So these are part of the thing that we really, really need to educate people against.
Okay, now you sounded very optimistic at the beginning about Nigeria attaining the open defecation free status by maybe, as you said, maybe hopefully before the end of 2022.
Yeah.
What are the things that give you this confidence? What are the things I would say are we doing right, or the government is doing right, and what are the things? What are some of the challenges also? So this is like two in one question. What are the...
Okay, so we have a clean-up secretariat in Nigeria, Clean-up Nigeria secretariat in Nigeria, which came as a result of that emergency that was declared, by Mr. President. And again, we should remember the Order 009 too, that declaration that followed the state of emergency. The state of emergency was in 2018, 2019 was Order 09 as declared by President Muhammadu Buhari. And we have a secretariat that is working around, the clock, to make sure that we work towards achieving, that target. Then again, at the level of CESDA, so we are again mobilizing stakeholders to make sure that we work towards achieving the same aim. Presently, with the support of British Council, European Union, British Council Act program, so we are able to mobilize stakeholders last week to say, come, let's talk together, rather than working in silos. And we are seeing that cooperation going on now. We need to be able to effectively fight the issue of open defecation. We need a lot of synergy. And we are creating that synergy. Now we are co-creating, platforms, opportunity to make sure that we achieve towards that. Before now, you see different governmental agencies working in silos, without, carrying along other sister agencies, to make sure that since we are working towards the same, goal, we should be able to compare notes, we should be able to share learnings, we should be able to, tell other agencies about what we are doing, at the end of the day. In the past, we don't see much of that, but now we can see that. Even from the WASH norm survey, you can see that synergy from MBS, National Bureau of Statistics, from Ministry of Water Resources, which is the coordinating ministry, from UNICEF. It wasn't a survey that was done in silos. You understand? They released that report and says that took hold of that report, and we help, to further escalate, some of the issues raised, in that report. And we are not just escalating it again. we are targeting, some of looking at how we can situate, the recommendations in the right doors of relevant agencies to make sure that they work, in consonance with, the findings of that report. So these are kind of things that we really need, to make sure that at the end of the day we work towards an open defecation-free Nigeria come 2025 or 2030. I think it's something we can achieve. We are doing it, and we are not going to rest on our horse. We continue to engage. We continue to advocate where we need, to do that. We are talking about some of the laws, the regulations, because we find out that at times implementation becomes a problem again. So because when we sample the opinion of people and say, why are you open defecating? Why are you defecating openly, in the public? Don't you know that there is a law that punishes that? Some of them will say, no, we don't know, and some of these agencies are not living up to their billings as well in terms of their mandate. So what we are trying to do is to spur them, to live up to the billings with regards to what they are mandated, about as far as, their offices, as far as these institutions are concerned.
Okay, so what are the challenges? I asked two questions. The other part, or do you think this issue of lack of awareness is?
Yeah. So we need a lot of education, just like I said, civic education now. So, and we have to be very methodological in our approach. So we have to be very systemic. Like, take for example, there are some communities that we might need to engage hygiene promoters. So their work, is to engage the community with right messages. Remember, different community has different problems. Some community has challenges of water. They have toilet, but they don't have water. The kind of toilet they have, supports use of water. And if the water is not there, it's as good as they don't have a toilet. So they need, to put a right information there. So then again, generally Nigeria, we need to begin to talk about, the effect. We should talk more of the effect.
Okay, well, talking about the effect, I read somewhere that malnutrition and child stunting are some of the effects of open defecation. How is that? Okay,
so oftentimes when the source of child water or food is contaminated and they ingest, these microbes that we are talking about, it brings about, what is it called? Diarrhea. And we all know the effect of diarrhea, stooling, vomiting, and these have a very great effect on the health of a child. So some, it results to tuberculosis, and at the end of the day, once a child has a tuberculosis, there's every tendency that it's going to stunt the growth of that child. So that is just part of the effect that we really need to consider. Because once it gets to the body system of any, not even the children alone, even the adult, and if it's not taken care of, so in some situations it leads to death. In some situations, it serves as a multiplying effect of what we are even trying to correct. Because once diarrhea sets in, you won't be able to control your bowel at that particular point in time. So once nature beckons, you want to do it, in that particular place. And as you are doing it there, just like we explained earlier, what is it called? Fly perches on that. It's going to further contaminate, the food or the drink, and it goes on like that. And that's why it's a very potent, open defecation presents a very great danger in the society. And it's something that we must come together as an individual, as an household, as a government, even the private sector. You remember again, just to buttress the point that we made, some months back, the FCDA in collaboration with Health, Health Secretariat, and then FCT Minister, we had a forum whereby we are talking about creating about 100,000 toilets, public toilets in FCT, across FCT, to stem, the tide of open defecation. And they invited the corporate bodies, the private, private sector, to that initiative to say that, look, as government, we can make available, map out spaces in the public that you can actually...
I've seen that already happening, and I think it's a good thing.
So
with this, I'm sorry, Mr. Babalola, we have to bring this discussion to a close. We are up against time. And thank you very much for coming, and we hope to have another opportunity for some similar discussions in future.